The basics of heart sounds. Heart sounds, often described as lubdub, are audible vibrations produced by the heart's activity. These sounds originate from the closure of heart valves, which creates vibrations in the valves themselves, the surrounding blood, heart walls, and major vessels. The primary heart sounds are, first heart sound, S1. Known as lube, it occurs at the beginning of systole and is produced by the closure of the atrioventricular valves, mitral and tricuspid. It lasts approximately 0.14 seconds. Second heart sound, S2. Known as dub, it marks the end of systole and is caused by the closure of the semilunar valves, aortic and pulmonary. It has a duration of about 0.11 seconds. Third heart sound, S3. Occurs at the beginning of the middle third of diastole, caused by the oscillation of blood between the walls of the ventricles as blood rushes in from the atria. Fourth heart sound, S4. Also known as the atrial sound, it occurs when the atria contract, produced by the rapid inflow of blood into the ventricles. Understanding these sounds is crucial for diagnosing various cardiac conditions and assessing overall heart health. Advanced heart sounds and rhythms. Beyond the basic heart sounds, there are more complex auditory phenomena that cardiologists and medical professionals listen for during auscultation, splitting of the second heart sound. During inspiration, the pulmonary valves may close slightly later than the aortic valves, causing a split in the second heart sound. This physiological splitting is normal but become more pronounced or fixed in certain cardiac conditions. Triple rhythm. When either the third or fourth heart sound is audible in addition to S1 and S2, it creates a triple rhythm. This can be a normal finding in some individuals, particularly athletes or pregnant women, but may also indicate cardiac dysfunction in others. Gallop rhythm. In certain pathological conditions with rapid heart rates, the third or fourth heart sound may become more pronounced and merge with S1 and S2, creating a rhythm reminiscent of a galloping horse. This is often associated with heart failure or severe cardiac stress. These advanced heart sounds provide valuable diagnostic information and require careful listening and interpretation by healthcare professionals. Auscultation and phonocardiography. Auscultation is the practice of listening to body sounds, particularly those of the heart, using a stethoscope. This technique requires skill and experience to differentiate between normal and abnormal heart sounds. Key aspects of auscultation include proper placement of the stethoscope over specific areas of the chest, recognizing the timing and quality of heart sounds, identifying murmurs and their characteristics, assessing changes in heart sounds with respiration and body position. Phonocardiography is an advanced technique that records amplified heart sounds as waveforms. This method provides a visual representation of heart sounds, allowing for more detailed analysis and comparison over time. Phonocardiograms can reveal subtle abnormalities that might be missed during standard auscultation and are particularly useful in research and education settings. Cardiac murmurs and their significance. Cardiac murmurs are abnormal heart sounds that occur between the normal heart sounds. They are often described as whooshing or swishing noises and can indicate various heart conditions. Murmurs are classified based on their timing, location, and characteristics. Systolic murmurs occur during ventricular contraction. Types include pansystolic murmurs, e.g. mitral regurgitation, ejection murmurs from pulmonary or aortic outflow tracts, late systolic murmurs associated with mitral valve prolapse, diastolic murmurs occur during ventricular relaxation. Types include early diastolic murmurs, aortic or pulmonary regurgitation, mid-diastolic murmurs, often from the mitral valve, continuous murmurs present throughout the cardiac cycle, such as the machinery murmur of patent ductus arteriosus. A thrill is a murmur that is intense enough to be palpable over the chest wall. The presence, timing, and characteristics of murmurs provide valuable diagnostic information about underlying cardiac conditions. Valvular and congenital heart defects. Valvular and congenital heart defects can significantly impact cardiac function and produce distinctive heart sounds. Some common conditions include rheumatic fever, an autoimmune response to streptococcal infections that can cause inflammation of heart valves. It leads to the formation of large, fibrinous lesions along valve edges, particularly affecting the mitral valve. Valve stenosis. Narrowing of valve openings due to scarring or congenital defects, impeding blood flow. Common in aortic and mitral valves, it can lead to distinctive murmurs and increased cardiac workload. Valve regurgitation. Occurs when valves fail to close properly, allowing backflow of blood. Often coexists with stenosis and can affect multiple valves, leading to complex cardiac sounds and symptoms. Congenital anomalies. Malformations of the heart or blood vessels present at birth. Examples include patent ductus arteriosus, septal defects, and tetralogy of Fallot, each producing characteristic murmurs and clinical presentations. These conditions often require careful monitoring and may necessitate surgical intervention to prevent complications and improve quality of life.